All right. Good afternoon, everyone. My name is Jeff Cooper, Health Commissioner at Public Health Dayton and Montgomery County. Thank you for being here today. I'd like to welcome our presenters today, provide vital information to our community. We have Commissioner Judy Dodge from the Board of County Commissioners. We have Mayor Nan Whaley from the City of Dayton. We have Nancy Moss Van, Public Health Project Manager for the Everyone Reach One Infant and Maternal Vitality Task Force. We have Sarah Hackenbrack from the Greater Dayton Area Hospital Association, who will be joining us shortly. And yes, he's here, Dr. Michael Doan, Public Health's Medical Director. So on Governor DeWine's news conference today, it was reassuring regarding the information that he, as well as Lieutenant Governor Husted and Director Amy Acton presented. The model and the modeling data that we've been using, obviously the actual number of cases where we are in this pandemic right now is much better off than where the original model predicted. And the reason we're there, yes, it's important that the governor issued these orders through the Ohio Department of Health regarding cancellation of mass gatherings and the stay-at-home order, but in all honesty, it's because of the individual actions of all of our citizens complying with those orders. It's one thing to have a governmental order, but I think all of our citizens understood the urgency and the need to comply with those orders. You take a look at a map nationally, and it's pretty clear that Ohio has taken this very seriously from the very beginning. We initiated actions almost from a preemptive strike standpoint, and we're a lot better off as a community and as a state. However, it's also important to note, and it was stressed today on the governor's news conference, that for those numbers to continue, that's based on continuation of the social distancing stay-at-home order. So we can't let up. We have to be concerned about a second wave, and we have to do everything within our power to make sure that we protect our citizens. So the main comments I'd like to make today center around one component of the governor's stay-at-home order. We've all seen that order, we've read it multiple times, and there are a variety of entities that are exempted from the requirements per se. And it really pertains to religious gatherings. We all understand the significance of this upcoming weekend and what that means to many millions of individuals throughout the world. We're all aware that religious entities are exempt from the mass gatherings, prevention of mass gatherings order, as well as the stay-at-home order. Well, there's a difference between a health order and doing the right thing. And this is a time to be very honest. We cannot be bringing a congregation of individuals together in an indoor space, all in the same area, regardless of the size of that area. We cannot be bringing large numbers of people together indoors for any reason when we're in the middle of this pandemic and we're trying to flatten the curve. That would simply be wrong, and we have to do the right thing. Keep in mind, no one has immunity from this virus, and many individuals are not demonstrating symptoms, but they're still infectious, and they can still pass that virus on to those who are most vulnerable. And when you take a large group of individuals from all ages, from the very young to the very old, congregating in a religious setting, that would be a recipe for disaster. And our governor has said it multiple times, and he's been very polite about it. He said it would be a very, very big mistake. It would be a huge mistake. We'll go farther than that. It's wrong. It's the wrong thing to do. Please protect your congregation. We now have the technology that during this pandemic, those services can be provided remotely, but whether online streaming through Facebook, Zoom, or YouTube. You can place information on your respective websites, or as many churches are doing, drive-through services are appropriate. Individual families should stay in their own vehicle, no mixing between the vehicles, adequate spacing, at least 6 foot between the vehicles, so make sure the parking lot is spread out. And then those services can either be provided through a loudspeaker or through FM broadcast channels per se. So technology exists. We do not have to bring large numbers of people together indoors to celebrate this obvious important upcoming weekend. It's the right thing to do. Please don't bring congregations together indoors in a large setting. And with that, we would like to welcome Commissioner Judy Dodge to the podium.
Thank you and welcome everybody today. I'm going to be giving some phone numbers and some websites. So if the people that are out there watching this, if you want to take a moment just to go and get a piece of paper and pencil or a pen and pencil, feel free. While you're doing that, I want to provide an update on our emergency operations. Our Emergency Management Agency, in partnership with St. Vincent de Paul, has shipped 150,000 pieces of personal protective equipment, or PPE, to frontline workers in hospitals, nursing homes, fire departments, and police departments. These supplies include N95 respirators, surgical masks, gowns, gloves, and thermometers from the Strategic National Stockpile. I want to take a moment to thank our staff, our friends at St. Vincent, and the frontline workers who will be using these supplies to battle this pandemic and serve our citizens. Now, for citizens who have lost work as a result of the pandemic, I want to remind you again that you can get unemployment benefits or help finding employment. People who have lost work can apply for unemployment at unemployment.ohio.gov or by calling 1-877-644-6562. Again, that's 1-877-644-6562. Now, please keep in mind that the state has received nearly 700,000 new unemployment claims over the previous 3 weeks. So your application may take a little bit of time. If you're having trouble getting through, please be patient. Try calling in the early morning or in the evening, or on weekends to try to avoid those busiest times. Now, our Workforce Development Department is still working with people to find jobs in these essential businesses. If anyone needs help finding work, again, that number is 937-225-5627. Again, 937-225-5627. We also have a list of companies who are hiring at www.jobcenter.org. That's www.jobcenter.org under the page COVID-19 Resources. Now, public assistance. The state has also issued Emergency Supplemental Nutrition Assistance, or the SNAP program, for local individuals and families. Households who did not already get the maximum allowable amount of benefits in March will get an adjustment on their EBT cards starting this week. They will also get the maximum for their household size in April. People can qualify for food assistance if they make up to 130% of the federal poverty level. Now, citizens can apply online for food assistance, Medicaid, and other public assistance programs at, and this is a long one, ssp.benefits.ohio.gov, or call 1-844-640-6446. Monday through Friday, 8 a.m. to 4 p.m. I'm going to give you the phone number again, 1-844-644-6446. The food bank is also providing emergency food to families with touchless service at their drive-through located at 56 Armour Place. Now, this drive-through is open 10 a.m. to noon tomorrow, which is this Friday, 10 a.m. to noon tomorrow, as well as 10 a.m. to noon next Monday, Wednesday, and Thursday. And that's next week, Monday, Wednesday, and Thursday. I have to thank the food bank as well as our local nonprofits and churches who are doing so much to ensure that no one in our community goes hungry during this very difficult time. Now, volunteers, you know, if you're feeling good, you're healthy, and you want to volunteer to help a local nonprofit, visit our COVID-19 resources page at mcohio.org and click on the link to volunteer. Now, local nonprofits can also visit us online at mcohio.org to request volunteers. So hopefully this is some up-to-date information for you, and everybody please stay safe and healthy and have a good weekend. Thank you.
Thank you, Commissioner Dodge. Next, we have Mayor Nan Whaley. Uh-oh. One popped out. Sorry about that.
That's all right, forgot.
Where did that come from? Just there?
On the paper, because if it hits
Oh,
something
that's
else,
what it was. Got it.
if it hits something else, it's like, makes, there you go,
Will that
thanks.
do it? Okay.
Well, hello, everybody. Good afternoon. Thank you, Commissioner Cooper, and thank you, Commissioner Dodge, for that information. So just a couple of comments today. First, I want to go into these cloth masks that we're collecting at City Hall. Again, City Hall is open from 8 a.m. It's not open. It's closed. But from 8 a.m. to 5 p.m., you can go to the front door. That area will be open to donate masks that folks can make. We need masks for RTA bus drivers. We need masks for grocery store workers. We have other organizations that are requesting them as well. Just to cover those two is about 400 masks. So we're hoping that the community listens, helps provide for these folks so we can continue for the much needed masks, like the folks that are packing the lunches for our DPS school kids who have also requested masks. So you can go there from 8 to 5 and drop them off, or you can mail them to City Hall at 101 West 3rd Street, Dayton, Ohio, 45402. They can have elastic, they can have rubber bands like they do, they can use bungee cords, you can use like the ones that the camera folks are having that has just ties, you know, any kind of way that you can make them, we'd really appreciate it. So we appreciate any donations of the public for cloth masks for the people on the front lines who are requesting them. Next, I just want to make a comment overall to the community. We have been effectively staying at home almost a month now. And I know that it is tedious, it is hard, it is a huge, enormous inconvenience. It can be painful, and sometimes it can even be dangerous. We have seen our overdose rates in the county increase by 85% year over year last month for accidental deaths. We know that people aren't getting some of the health efforts that they need, you know, through telehealth. So we know that we're trying to reach and fill those gaps. We're doing the best we can. So I want to encourage everyone, though, because they're doing such a terrific job with the stay-at-home order. The fact that Montgomery County has seen 2, is it still 2? 3 deaths?
4 now.
4 deaths, thank you, 4 deaths, which is much less than any other county our size in the state of Ohio, and that the state of Ohio is doing so well, has everything to do with the seriousness that Daytonians are taking. Now, I believe that we're really good at this because we've been practiced on how to handle disasters. We look for good information, we follow that information, we know that it's the best for our community. And I also believe that Daytonians care about their community, quite frankly, more than other communities do. So while this is painful, while this is tedious, while it is so difficult to homeschool your children, I want to say thank you. I want to also say we are doing so well, we cannot let up. Please look after your neighbors. If you're considering using or using, please call the Adamus Helpline. We have ways to help you. Please take care of each other like you've done so well before and have done this past month. I know we can do this, Dayton. We're doing it right now. Have a great evening.
Next, we have Nancy Moss-Van from Public Health. She's the project manager for our Everyone Reach One Infant and Maternal Vitality Task Force.
Thank you, Commissioner. And good afternoon, everyone. My name is Nancy Moss-Van. It's my honor to serve as the program manager for Everyone Reach One, the Maternal and Infant Vitality Task Force. Today, I'd like to bring you a few updates as they relate to COVID-19 and pregnancy. Thousands of women in our community are currently expecting. While our work typically centers around those who are most vulnerable, the information that I'll share today can apply to all pregnant women, understanding that healthy moms are much more likely to give birth to healthy babies. There is currently no evidence that COVID-19 adversely affects pregnancy or passes from moms to babies during pregnancy, delivery, or breastfeeding. Here are a few additional things to keep in mind. First and foremost, talk with your healthcare provider. They are always your best and most important point of contact. Pregnant women should also follow all of the advice already being shared with the general public to avoid infection. Avoid those who are sick. Clean your hands with soap and water or alcohol-based sanitizer. Be mindful of distancing and avoiding crowds. Avoid touching your eyes, nose, and mouth. And if you have a fever, cough, difficulty breathing, seek medical care early. Call before going to a healthcare facility and follow the directions of your provider. Please refer only to credible websites. Of course, I have to recommend the Everyone Reach One website, which can be found at mceveryOneReachOne.org, as well as the websites for Public Health, Dayton and Montgomery County, phdmc.org, the Ohio Department of Health's COVID-19 site, coronavirus.ohio.gov, or the Centers for Disease Control and Prevention at cdc.gov. If you need help or additional information at any time during or after your pregnancy, our Bureau of Maternal and Child Health has a team of neighborhood navigators who are ready to assist you in connecting with support services throughout our community. They can be reached by calling 937-496-7718. There are a few things to keep in mind before you go into labor. Most prenatal appointments are being conducted via phone, teleconferencing, or telehealth. Some in-person appointments will be necessary and should not be missed. Pregnant women and those who have recently delivered should attend scheduled in-person appointments, but they will need to do so alone. No visitors will be allowed to come with you, including children. For pregnant women with underlying conditions that put you at risk, including cardiovascular disease, lung disease, diabetes, high blood pressure, it is very important that your birthing team know about that in advance so that they can create a personal care plan appropriate to your needs. As you're preparing for labor and delivery, hospitals have new policies and directives regarding who and how many support persons can come to the hospital with moms. Hospitals and birthing centers in the Miami Valley have outlined the following parameters as they pertain to labor and delivery. Although no visitors will be allowed for most hospitalized patients, exceptions will be made for maternity patients to allow one healthy support person, and patients under the age of 18, including babies that are in the NICU, may have 2 healthy visitors, but they are limited to parents or guardians. If your birth plan does include having another birth support person in the room for labor and delivery, please check with your healthcare provider or birthing facility ahead of time to learn about alternatives to in-person support. The use of technology will be key for video conferencing and telephone support. We understand that pregnant women may be hesitant to give birth at a hospital. Even now, it is still the best choice by far to give birth to your baby at a licensed, accredited hospital or birthing center. The medical professionals there will assure you're getting the best possible care, have all necessary equipment to anticipate every need, and are taking extra precautions during this pandemic. Once moms and babies go home, please remember that babies' immune systems are not as robust as ours, and it's our job to protect them. It may be difficult to do because people always want to see and interact with new babies. But please minimize contact with other relatives and friends coming into the home during this crisis, even being careful about exposing your baby to siblings living in the home. Also, please remember to practice the ABCs of safe sleep, positioning babies alone, on their backs, and in a crib. Now, just a few reminders about breastfeeding. Nothing has changed about breastfeeding being the optimal choice for nutrition for infants, even during this COVID-19 pandemic. Breast milk provides protection against illness and disease like nothing else can. The director of the Ohio Department of Health, Dr. Amy Acton, strongly recommends that new moms continue to safely feed their babies by following these CDC recommended steps for feeding with any respiratory infection. If a mom is showing symptoms like a fever, cough, or shortness of breath, or contracts COVID-19, she could continue to breastfeed while taking all necessary precautions to prevent the spread, including wearing a mask or face covering. Moms should wash hands for at least 20 seconds with soap and water each time before they touch the baby, preparing a bottle for breast milk or formula, touching a breast pump or bottle parts, or expressing milk. Women with COVID-19 should remain isolated from other family members except to breastfeed, and if possible, have someone that is well take care for and feed the express breast milk to the baby. Please remember that homemade baby formula recipes found online or on social media are not recommended and can be dangerous for your baby. If you have any questions about breastfeeding, contact our local WIC office for further guidance at 937-224-6166 or call 844-601-0365 to connect with the WIC clinic closest to you. And finally, relax. Take the time to de-stress however you can, reading, meditation, exercise, or music. Turn to your family, but not in person, for support. Virtually connect with other moms and moms-to-be. Eat a balanced diet and drink plenty of water to stay hydrated. And just because we should be physically separated doesn't mean we can't have virtual contact with others. We need each other now more than ever. To you and your beautiful babies, stay safe and be well. Thank you.
Thank you, Nancy. Next, we have Sarah Hackenbrack from the Greater Dayton Area Hospital Association.
Good afternoon, everyone. Our region's hospitals and healthcare institutions continue to dig deep and work collaboratively as we prepare for these COVID-19 pandemic and these unprecedented times. We are working collectively to refine our preparation tools and take in all of the new information and data and resources that continue to come out of our federal and state partners to amplify the planning efforts that we have been working on locally. But I'd like to also take a moment to recognize some positive things that have been happening in our community, and that is an extremely generous donation from Crocs that are being delivered to our area hospitals and healthcare providers starting tomorrow. And they are donating 14,000 pairs of Crocs for our area healthcare workers who are serving on the front lines of this clinical crisis. In partnership with the Dayton Development Coalition and Jobs Ohio and Heidelberg, our local community has risen together to partner and make sure that we can get those donations from Crocs separated out by facility and then physically transported to each of the hospital facilities where they can distribute them to their frontline healthcare workers. So thank you to the local community. Thank you to Crocs and Dayton Development Coalition and Jobs Ohio, as well as Heidelberg, for making sure that we could accept that gift on behalf of our local hospitals and put those Crocs out into good use in our community. Simultaneously, we have had a large response in outreach of individuals who have either medical backgrounds or medical careers that maybe they've set aside and are now looking for ways that they can give back and donate their time in our local community. And so last week we learned a little bit more about the United Ways process for volunteers and for organizations that have a need for assistance. And we have also partnered as the Greater Dayton Area Hospital Association with United Way and the Montgomery County Emergency Management Agency to establish a fully streamlined process for volunteers with community and social service agencies, as well as our healthcare agencies in the community. This streamlined process will be essential for nonprofit organizations who may need additional staffing and support during this COVID-19 crisis. This process is specifically designed for those entities and organizations that are considered essential during the COVID-19 process. So these would be efforts that support our basic human needs like hunger, shelter, and physical and mental health. Individuals that want to volunteer their times, their talents, and their service can sign up online, and they'll have to be able to meet the individual agency requirements as well as the age and health and professional requirements of the organization for which they wish to serve. The forms for healthcare workers specifically are on declare.org/give medical help. And I'll read that again. That website is declare.org/give medical help. And that will allow anyone in our community who has a healthcare background who is looking for the opportunity to give back in this region during this time of COVID-19 and to safely volunteer with agencies who can put their talents and their time and their treasure to good use. Thank you.
Thank you, Sarah. And now, the one, the only, Dr. Michael Doan.
Thank you, Mr. Cooper. I don't know why I get that kind of an introduction, but there's something that I've done in my life that I'm being paid back for, I think. I am Dr. Michael Doan. I'm Medical Director for Public Health, Dayton, Montgomery County. And I wanted to say a few words about something because there's going to be a change in the things that probably you're looking at. I'm assuming that all of you that are watching this, you're doing it because you're interested, that you're getting information from lots of different places. One of the things you're probably looking at is the number of cases in Ohio day by day and sort of watching as that goes up. Up to this point, what counted as a case was a person who was sick and had a positive test. We've all said there aren't enough tests. We all know that people have been told by their physicians if they're sick, stay home until you get better, etc. But the only ones that counted as a case were the ones that actually had the test and had the virus demonstrated. Starting now, the count is going to include not just those cases that had the positive test, but also people that have probable cases, okay? That means people that are sick, that meet other criteria such as contact with a case, other kinds of criteria, perhaps laboratory criteria, and those people will then be counted as probable cases. What this means is that the number of people that are going to be counted as cases is going to increase to include some of those people that previously haven't been included because they didn't get a positive test result because they couldn't get the test, okay? This means that over the next couple of days in the week, the number of cases is likely to go up a lot. As that happens, that doesn't necessarily mean things are getting that much worse. It's just that we're getting a better count of who's actually sick and who actually has this disease. As a consequence, it makes it difficult. This is the sort of thing where you say, before the case definition change and after the case definition change. So there's going to be a disruption in what those numbers are, but then it's going to kind of continue on at the same way, and we'll look at the same kind of increases in those or decreases, and we can compare. It's just that right now there's going to be a step where things are going to look a little bit more like, you know, more people are infected, when in fact we're just going to be doing a better job of counting them. That's really all I had to say.
Thank you.
And so just don't be alarmed by that. It's going to happen. And, you know, we've said, I mean, I don't know how many times the commissioner has said, don't get hung up on those numbers because there's lots of other people out there that are infected also that aren't getting counted. This is just an attempt to get a little bit better count. It's still not going to count everybody, but it's going to count the cases that haven't been tested, but we're pretty sure really have the COVID-19 disease. Thank you.
Are we going to see these numbers tomorrow change or in 2 days?
Well, it's going to take a little bit because people have to. This is going to be reported to health departments all across the state. The people that reported across the state have been set up just to report the positive tests. So now they're going to have to say, does this person who hasn't had a test meet these criteria? And we'll have to report that. So there's going to be a little bit of time as people sort of figure out how, you know, what those criteria are and who to get reported. We're not going backwards, so we're not going to go back and start counting people. It's just going to start at this point, and then moving forward, as the physicians and other providers sort of get on board with this, they'll be able to call those cases into public health as well, and we'll still, of course, get the test results back. Any questions for anybody?
I think we have some callers here too. Does anyone on the line have any questions for us?
Yes, this is Drew from WHIO. This is a question for Commissioner Cooper. You know, we've seen a big spike in people holding parades in their communities for birthday parties and other types of celebrations. Obviously a great positive thing to see in the community. Just curious though, from a public health perspective, what is public health stance on this, and are these able to be done under the stay-at-home order?
Hi, Drew. This is Jeff Cooper. So the question was, did everyone hear the question? Okay. The question was, we've seen an increase or a reported increase in individual parades per se in communities celebrating birthdays and other things, people staying in vehicles. So for us at Public Health, our interpretation of that is we need to stay in line with the director's stay-at-home order. And under number 5, leaving home for essential activities is permitted. And it's pretty clear what those essential activities are. Health and safety purposes, for necessary supplies and services, outdoor activity in terms of recreation, certain types of work, and we all understand the difference between essential and a non-essential business or operation, and then to take care of others. So those parades do not meet the intention of the director's stay-at-home order, and we would say those need to be discontinued. That's not something that's fun to say, but that's the reality of where we stand right now.
Thank you. And then I just had another question. This is for Sarah with Gadaha.
She's coming up, Drew.
Hi, Drew. Go ahead.
Hi there. One of the questions that we've had in our newsroom is the negative pressure rooms that we're seeing at hospitals. We've seen them talked about kind of at the beginning of this coronavirus pandemic. Where are hospitals at with those? Are you seeing across the Gadaha system Are you seeing those nearing capacity, or are they doing pretty well? What's kind of the ballpark of what you guys have been seeing in those rooms?
So the question was overall in regards to capacity, specifically the negative pressure rooms. How are we doing in terms of capacity in the region? And I would have to look at the numbers for the negative pressure rooms specifically. I did not look at that before I came over here today. But overall, as a region, I can say that we are doing very well on hospital capacity. And part of that is truly because we are not seeing the surge that we had thought we might see at this point in time. That doesn't mean that the surge isn't still coming, and that is why the stay-at-home orders and the instructions from Director Acton, as well as the Health Commissioner and others, are so important to help us continue to manage this curve. And simultaneously, the governor's executive order from early March, where we suspended and delayed non-essential surgeries, helps us manage the volume and capacity in our region's hospitals. Part of the work of our region's hospitals since March has been really looking at all of the spaces within our hospital facilities to modify or create spaces where we can safely treat COVID-19 patients. And so that might mean building in additional infrastructure for some rooms to be converted to isolation or negative pressure spaces, and then also increasing our intensive care unit spaces.
Thank you so much.
Anybody else on the line?
This is Lila from WISO. I also had a question for Sarah Hackenbracht.
Sarah, popular today? Okay. Excuse me.
In an earlier, maybe a few days ago, you mentioned that that the region doesn't really intend to use the Dayton Convention Center as an alternate care site, or at least that our region is working to have everyone treated within existing hospitals. I'm wondering, why was it selected? Like, are there plans for patients from other counties or regions to be treated there?
So we are an 8-county region within Region 3, and that is assigned through our Ohio Department of Health region. And when we are looking at our regional capacity, we are actually building a multi-tiered plan for surge capacity within our region. And so the first 2 areas of surge that we want to be prepared for is to care for individuals within our area hospitals, and then to care for individuals inside the walls of other healthcare institutions. Those might be rehabilitation hospitals, they might be long-term care providers, they might also be mental or behavioral health providers, where they have appropriate medical spaces that we could care for COVID patients as well as non-COVID-19 patients. And so as we continue to look at our capacity building and plan, we certainly have built in the need to activate a crisis community center to care for patients should we reach absolute critical capacity. But currently our belief, based on the modeling and the surge numbers, is that we intend to care for the majority of patients, both COVID and non-COVID-19 patients, inside the walls of our healthcare institutions.
Thank you.
You want to say something? Anybody else?
I'm just going to make one final comment.
Thank you.
So we're very appreciative of our speakers, and every time they come here to give updates to our community. And it's a lot of detailed information. And sometimes it's complex and it's not easy to communicate, but they've done a fantastic job of distilling that down to where everyone viewing this can understand it. And today, and I have to apologize, for the first time ever, I tried to focus a lot on our interpreters in terms of how they were receiving that information and then communicating it. And I just want to say that the work you do and that skill is fantastic. I just can't imagine how talented you are. So that's tremendous. So thank you.